All right, hello everyone, and welcome to this seminar presented by the Boston chapter of the Boston National Association of Black Journalists. I'm Rony Camille, and I will be your moderator for this conversation. I'm joining you tonight from my living room in Nashville, New Hampshire. Also joining us are our three panelists, Dr. Nicole Christian-Braithwaite, Farley, and Dr. Ernestine Jennings. We want to thank them for taking the time to join in this important conversation, because in just a matter of weeks, the world as we know it has changed. The World Health Organization has declared COVID-19 a global pandemic, forcing many of us to change our way of life. And as we tape this webinar on Wednesday, April 8th, the cases of COVID-19 are spreading and the deaths are rising. And tonight, we are learning that data gathered by some cities and states show African American and Latino communities have been disproportionately affected by this pandemic. So where does this leave us as journalists and communication professionals? We can't underestimate the extreme emotional trauma that many of us are feeling right now. The stories evolving minute by minute, and often the level of uncertainty takes a toll on our well-being. Many of you watching know how to cover major events, but what happens when these stressors occur day after day with no certain end in sight? Whether you're home working or in a nearly empty newsroom or even out in the street on the front lines, you're dealing with coronavirus at work and you're dealing with coronavirus at home. We also know for some of you, it's hitting close to home too. Some of our colleagues, acquaintances, friends, and even family have either been diagnosed or worse, have died. So in the next hour, our panel of experts will share how you can tackle the various challenges related to this pandemic and how you can survive the stress and negative thoughts. Before we get started tonight, I do want to bring on Gary Washburn, our chapter president and sports reporter for the Boston Globe, to say a few words. And he joins us from his home in Boston. Gary?
I just want to thank all the panelists for joining us. This is a very pertinent and important topic. I want to thank Rony for putting this together. This is a very, it's just so important right now. Hopefully, I think everybody is going to get something out of this for the next hour, and we can, kind of take this discussion and move forward our lives and hopefully help this situation. In all the different situations we're going through, hopefully this will help, because some of us are, not working now, furlough, whatever. Hopefully we can deal with this emotional and, mental stress.
Great, thank you so much, Gary. Let's introduce our panelists. So joining us from her home in Boston is Dr. Nicole Christian-Braithwaite. She's a board-certified adult and child psychiatrist with a specialty in PTSD, race-based trauma, implicit bias in medicine, and pregnancy, postpartum mood disorders. Dr. Christian-Braithwaite is the CEO of Well Minds Consulting. Hi, doctor, and welcome.
Thank you.
Joining us from her home in Nashville, New Hampshire, not too far from me, is Farley. She's a certified stress management coach with CFar, Beyond the Box. She works with various organizations and corporations in culture check and stress level identification workshops. She is the co-host of two podcasts, PTSD, People, Trauma, and Stress Discussed, and The Farley Show. Crystal is also a combat vet, having served in the United States Air Force Reserves with a tour in Afghanistan. Hi, Crystal, welcome.
Hi, thank you.
And joining us from her home in Barrington, Rhode Island is Dr. Ernestine Jennings. She's a staff psychologist at the Miriam Hospital and professor at the Warren Alpert Medical School at Brown University. Her primary work is in behavioral health. Doctor, thanks for coming on tonight. And before we start, I also want to tell our attendees that we want to make this webinar as interactive as possible. So if you have a question, please drop it into the chat. If you're on the phone, you can press *9, and we'll try to get your question answered as best as possible. So, Doctor, Nicole, Crystal, and Dr. Jennings, let's dive in. What kind of stress comes from an event such as this? And how is this different from other events? And why is this traumatic?
Who's going to go first? Dr. Nicole?
Sure. So, I mean, I think, well, one, stress is on a spectrum, but this is obviously very unique. So there's some type of stress that's obviously helpful. So when we have a deadline or when we have certain things we need to do, that type of stress actually builds resilience and strength. But when we get to the type of stress that we're dealing with, it's unpredictable. We don't know what's coming. It's prolonged. And that type of stress can actually lead to more destructive outcomes. And that's obviously why we're here and some of the concerns. And so, prolonged toxic or destructive stress can lead people to have an increase in anxiety, isolation, mood disorders, substance use, and a lot of this is out of our control. And often when we start thinking about what leads to trauma, one of the big issues with trauma is when it's unpredictable and out of your control. And as we'll talk about later, a big part of this is trying to control what you can control to try to limit and reduce some of the stress that we're experiencing.
So where do we even begin as individuals in dealing with all of this emotional stress during this pandemic, for ourselves and our families?
I'm going to jump in just for a second because I think that the one thing that has sort of really reared its head at me is that, there's stress every day anyhow, right? So acknowledging that life has happened and it continues to happen. And now we have this thing, right? That has changed how we're living every single day. And as Dr. Nicole said, we don't know what's going to happen. It's prolonged, it's uncertain, we have no clue. So I think, honestly, the first step is admitting that we're stressed out. I think oftentimes, especially being a female and a mother, I feel like I have to keep it together all the time. So for me to admit that I'm stressed is the first step to me even trying to overcome anything ever.
Sure.
And I think acknowledging that we all naturally react to stress. I think a lot of times people, a lot of people are saying, why am I reacting this way? And I'm saying, this is so normal. Right. If you didn't, I would be concerned. And so I think just recognizing that when people get rattled, things get out of control, it's just how you respond to it. And I think that's what we'll speak about as well. But I think understanding that this is a natural reaction to something that is uncertain and normalizing it for people is important.
And how does one kind of distinguish the difference between all the various emotions and we're feeling? There's a difference between having anxiety versus stress and being overwhelmed. Is that right?
Absolutely. And I also think it's the impact it has on you, right? So I tell people a lot of times when you're dealing with stressful situations, anxiety and worry, you may get exhausted. You may start to feel tension in your body. That's different than, as Dr. Nicole noted, that when you get a certain amount of stress, it kind of energizes you and you say, hey, let's go hit this story. I'm ready to go.
Sure.
So there's a different, the response that you have to that really is telling on the impact that the stress or the event is having on you.
So what are some of, sorry, go ahead, Dr.
No, I was going to say, I completely agree. I start to worry when patients indicate that their quality of life is changing, or their quality of their relationships are changing. And so that's when because again, I totally agree. We can't pathologize every emotion and every anxiety because we're all nervous. You watch the TV and you're like, good grief, what is happening in this world? And again, that's normal. But if it starts to impact your sleep,
absolutely.
If you're sleeping too much or sleeping too little, your appetite's changing, you're suddenly not maintaining basic stuff like your hygiene. You're not just social distancing, you're isolating yourself from your friends and family. That's when I really start to get concerned because those core qualities of your life are beginning to break down.
Sure.
With that too, just to chime in, first, do you see my dog? Because she's the cutest thing ever, right? But I think too, along with all of that, I oftentimes, when I'm talking to people, I say, depression is being sad about things at once before, and anxiety is something we're worrying about things in the future. And I think we're sort of in this point of we're feeling both of them at the same time, right? Because we're grieving the loss of the life we had before, and we don't know what's going to happen tomorrow. So I think both of these women are absolutely right in how it manifests itself. But I think in addition, it's, you know, focus. Are you able to focus? Are you able to, you know, identify where your shortfalls are when it comes to boundaries? Are you taking care of yourself? Because for me personally, like I worry more about what the repercussions will be mentally for people going through this right now, because as we've said, like we are isolating, we are removing ourselves from normal connection, which is what we all need. So sort of, you know, identifying where those changes are happening now while we're alone, and how we're even going to be able to pivot when we have to go back to the old normal, the new normal.
Right. I was going to say, there's no old normal.
It's old normal, new normal, future normal, whatever it was.
God, it's God, you know, and that's what I'm telling people. We're not going back, you know, and I think a lot of times people will say that, you know, I just want to get back to my normal. I'm like, good luck. It's not happening. It's really about from this point forward, what are we going to do? And I think when people recognize that, and even in this moment, recognizing that that's gone, but what we're going to do is move forward, and we're going to see and be hopeful. That's helping people. And I understand that some people struggle at that time, but I think a lot of people do grieve that old normal, and they spend so much time trying to get a hold of that they're losing out and may lose out on the opportunity to move forward. So,
I completely agree, but I think it's okay to say we're grieving.
Absolutely.
Like, I think it's
tell
okay.
People all the time, we're grieving daily, and we're grieving collectively. So that's what I'm saying. Like, don't think that you're going through this by yourself, because there are a lot of people that are experiencing what you're experiencing, and to talk about it and to be open has been helpful.
So with all of this uncertainty of it all, not knowing when this pandemic will be over, how important is it to have the right coping skills to all of this? And what are some of the things that you can suggest to the folks watching this right now?
Yeah, so I will just say, some of the patients that I've been dealing with, I see patients in primary care. So our interactions are usually short-lived, and usually 4 to 5 sessions, but some of them have been calling back up. And so what I tell them is we go back to our grounding, you know, being mindful of what we're doing, setting a routine. These are very basic strategies, being, you know, setting a routine, I always ask about sleep and good sleep hygiene, those kinds of things, making sure that they're staying in connection with people some way, like through conversations or even text, but making sure that they're able to do something each day that kind of holds to who they are. So that's very basic, but something that's grounding them in this moment today.
Dr. Ernestine, you talk about the benefit of social interaction.
Absolutely.
What do we lose when we don't have that? When people are kind of, you know, secluding themselves, you know, they're home alone all day. Well,
we know that social support is one of the main things when we look at at least for me, any behavioral intervention, it's one of the main components we try to make sure is there, because people are able to find purpose in what they're doing. They're also able to share, to, like I said, do things collectively. So if they're, you know, if you see someone else is struggling and you're struggling, that kind of helps you go, okay, I'm not in this alone. So it gives you that ability to reflect as well. Sometimes I do groups and I'll have patients and I'll say, we're going to do a group, and they're like, I don't want to hear other people's problems, but they end up being the main person who benefits from sharing their story, right? So I think those are the other things to keep in mind.
I think the other thing too is, like, we don't have to do everything today, like right this second. Like I noticed that with a lot of the organizations that I work with, that a lot of the people were feeling, including myself, feeling like the routine that is so important that we all need to have, like, you know, thinking about kids and ourselves and the structure and the work day and the school day. We were expected to pivot in like 24 to 48 hours to, you know, go from working in place or going to school in place to now home, right? Like it's a really big shift. And I know, like, a lot of individuals put the pressure on themselves to have that routine, like, ready to go the day after we're told to do something different. And I think the reality is, like, understanding and giving ourselves grace that that's not going to happen, right?
And it's a routine, it's not the routine, right?
Right,
so
exactly.
What I say to my patients, they're, you know, people who were in the middle of changing their diet, we were like getting really good. I was like, you know, let's forget about, you know, the handcrafted meals we were working on. Let's just make sure you're getting your water in. Like, we're just doing the basics.
Right.
Why-
Success can be this big.
Absolutely.
Like success doesn't have to be like the universe, right?
Yeah.
Dr. Ernestine, why do you say that? Why do you say people should just start? I mean, if they were on doing the meal preps and all that, and you're just saying, all right, just focus on one thing. Why are you saying that? Why not just maintain the same routine that they were doing before all of this started?
Right, because the things that they needed, like the grocery store is not available. Their their chef is not coming. Like, you know, it's not happening.
No?
So, well, you know, that's other things, you know, not every day like it used to be, you know. So some of those things aren't available. And what I remind them is that when we started, we were starting at the basics. And when this is all over, you're going to need to get back to basics as well. So it's really about, hey, we're learning about maintenance. And when stuff comes up, so with any behavior change, I always say, stick to your basics. And, you know, I don't play basketball, but like the fundamentals, right?
Yes.
So understanding what those, and so I think this is a really good time to highlight for people what the fundamentals are. And then they'll branch out. Like I said, the chef will be back. But for now, let's just figure out how you can keep yourself, you know, with that healthy mindset. Getting your water in is just as important. You don't have the same schedule. And that's what I was finding. They were getting dehydrated. I'm like, what's going on? Oh, I'm at my desk all day, or I'm at my computer all day. I'm not drinking my water like I used to. All right, that's basic. Before you're chopping up any vegetables, we need to be drinking water.
And I would also say just moderate all expectations. I'm a mother of a 3-year-old and a 5-year-old. We are just not going to get a lot of work done during the day. And I just have to be realistic about that. Like I may not make every Zoom. I may not do every assignment listed, but instead of seeing the day as a failure, I'm like, okay, but we didn't have a 1-hour tantrum today. It was a 10-minute tantrum. Right. So, you know, that was a success. And so really looking like at the small victories, because it's so easy to get wrapped up in the negative. And Rony, I'm not sure if the audience can see this, but I sent you kind of a list of coping skills that I often recommend for my patients.
We will send that out to the folks in the webinar, but we could put that up on the screen now. Hold on a sec. Let me navigate.
I like your sign there, Dr. Nicole, though. It's a good day to have a good day. Because I think that's a really great coping skill right there, just saying that out loud.
So can you guys...
and it's a long list. So and again, like as everyone has said, it's not something that's expected that you do now, but we just bite off small chunks. And one thing that I realize, a lot of people are kind of going through days without doing basic things they were doing in the past, like showering and getting dressed and eating at the same time. And again, because the external world is so unpredictable and out of our control, one coping strategy is to try to control, again, what you can control. So what small things in your life can you actually control? You can control what time you wake up and when you shower and what time you eat. And it is unrealistic to schedule everything, but maybe you can schedule meals. And at least that's something that you know is coming in your day. And that alone can be helpful. And gratitude is a big issue, a big issue for me. And we've seen in so many studies that simply expressing gratitude in the morning or before you go to bed can actually really improve your quality of life. Absolutely. And it forces us to try to find the positive in really difficult days. So if you have to, before you go to bed or when you wake up in the morning, focusing on something that you're grateful for, something that you're appreciative of, it changes our perspective. Absolutely. And it changes the way that we're thinking.
Well, I am giving gratitude to you three for being here and the attendees on this call tonight. To go back to a question I wanted to ask, one of you had kind of brought this up, you know, the whole routine. We're transitioning from being in the office and now at home, or school and home, and, you know, we're trying to get into that routine. What are some of the physical symptoms or feelings that, you know, someone may not even notice is happening throughout this time? They say, oh, everything's fine, but there are some symptoms that are physically happening. What would those be?
And I think it's also important to acknowledge that as African Americans, we tend to express stress and anxiety in our bodies anyway. Yes. And so it's not uncommon that when we are feeling anxious or depressed, that suddenly we're exhausted or we're having headaches or our heart's racing or we're feeling nauseous, having stomach pains, or just feeling like you have a weight on you, or suddenly you lose your appetite. And in general, people of color, again, tend to kind of display what they call somatic symptoms. And so oftentimes we ignore those and don't acknowledge those as being connected to being in emotional distress or being anxious. And so I just really encourage people, please don't ignore your body, because it's communicating, it's telling you something. And I think we often assume that we just have to deal with it. Like Black people, where we've always struggled, we have to just keep struggling, but we don't, and we shouldn't, because it's wearing on us, and it will continue to wear on us until we actually stop and listen and take heed to what our body is telling us.
Well, and that's the whole thing, right? Like stress is going to lower your immune system, right? And so if you're having more stress and you're already exhibiting these, having these feelings and these emotions and that sort of thing, you're already more at risk. What more at risk can you be, right? And so I think that's a really great point. And I think the other thing is too, Dr. Ernestine, you touched on it too, like focus. Like if you are forgetting to drink water, you're not able to focus on like your normal, like what would be normal everyday tasks, then there's probably something off too, right? So mentally, I think like with your brain, your cognitive brain function, there's a little bit of shifting as well.
When I talk to my patients about anxiety, I often say that when we become anxious, we see it as a threat. That's what's going on now. We feel threatened. And one of the first things we do when we feel threatened is we stop breathing, right? We clench up and we get ready for whatever it is. We're going to fight and flight, and that's a whole nother lesson, right? But what we do is, so we clench up. And so what happens, right? Oxygen is gone from our body. Our shoulders get really tight. Our heart starts racing. Blood leaves our stomach. You don't need to digest food if you're running from something, right? So understanding that those are just natural responses to stress or to worry or to anxiety.
So the feeling of being hungry, but you're not hungry.
Right. You don't need that. You don't, and that's about and that's again, another issue in terms of when we're stressed, cortisol levels rise, and that causes changes in our appetite and how we function throughout the day. So there's all these other things that are going on when we just, see whatever stressor, and that's just day-to-day stress. And then you have this chronic stress that's going on, and so your body's not able to manage it. So you do have a lot of things going on physiologically that are affecting you mentally. So that's why I tell people, you're doing something, you're responding to something, and so you have this natural. So one of the first exercises I do with all my patients is we start breathing in my office. They walk out of there like, oh, here she is again. But I'm like, if that's that, because the first thing you do when you feel a threat is all of us, like, just do that. And so teaching people how, I do a progressive muscle relaxation exercise, and I'll say, clench your shoulders, and people are like, what do you mean? Right? Because their shoulders are already up here, So when I say drop them, they're like, oh, wow. So we do this natural thing, get ready. And okay. So just teaching people how to do that. Oftentimes, like I said, I spend 5 to 6 sessions with people. And oftentimes it's just practicing that over and over. And they're learning how to respond when they feel that. So
doctor, how is breathing important in all this? I mean,
well, for me, I think, again, it turns off the system that says you need to run and fight, right? So it's like I said, there's a whole other lesson about that, but just in the basics, it's kind of training the body that just because we see a threat, we don't have to respond that way. So the breath allows you, one, to, we're going to hopefully talk about mindfulness and how to be in the moment. So that helps. The oxygen, again, getting to your brain, the front of your brain, allowing you to make decisions. When we're getting that stress response, we're in that, we're just ready to go. We're not thinking about who's to the left or right. We just got to go. So breathing actually slows you down, allows you to focus. You can start to make decisions. Like I said, you get oxygen back to your frontal cortex, and, your limbs kind of feel like, I can do this. And then you can make a decision, and you just kind of train yourself how to be calm in those situations that make you tighten up naturally.
And it's important to actually make sure you're breathing, fully breathing, because we're so used to hyperventilating because we're in a hurry. We have so many things to do, and the diaphragmatic or the deep breathing actually feels unnatural. So and I know it sounds crazy, but learning how to breathe. So if you were to put one hand on your chest and one hand on your stomach, and you take a deep breath in, you really want the hand on your stomach to push out farther. So that's how you know that you're really expanding your lung. You're getting all the oxygen that you can get, and then you're kind of slowly breathing out. And again, physiologically, your blood pressure will lower, your heart rate lowers, your body starts to slow down, and you are able to think clearly with the frontal executive functioning part of our brain.
You can
but
breathe
it really
anywhere.
takes, right, and it does take practice.
Yeah,
We don't even realize that we're not even using the full capability of our lungs.
You know, the other really cool thing is about breathing like that is that you're actually only thinking about breathing.
Right.
You're not thinking about the 6,000 other things you have to do in that moment.
And you're being mindful. And that's one of the things we want to be, you know, you talk about depression and anxiety about the past and the future, but it allows you to be in this present moment. And that's really the only thing you have control over, even if you do have control over anything. But that's the only thing that you really can respond to is what you're dealing with in this present moment. And when you feel like you have confidence about doing that, it really opens it up for people.
Mm-hmm.
So to the panel, if someone's having a real spike of anxiety and the breathing techniques aren't working and they're stuck at home all the time, can't go out, can't do this, what can they do?
So one option, and I mean, all of these seem obvious, but when you're overwhelmed in the moment, they may not be as obvious, but so exercise, often when we're immobile, it feeds that sense of lack of control and fear. So anxiety is uncontrollable fear. And sometimes you can identify why you're afraid and sometimes you can't. And your body is essentially feeling like it's in danger. And so everything that we're doing is to try to let our brain and our body know that we're safe. And exercise and increasing cardio and feeling like you're in control, that helps. So, you know, even I often use a lot of sensory tools. So I work with a lot of kids and adults with trauma. And sometimes when they're in that mode where they're feeling completely overwhelmed, talking doesn't work, breathing doesn't work. So I try to use the 5 senses. So I'll tell kids, keep a bag of Sour Patch Kids with you. And when you're starting to really get overwhelmed, just put a whole bunch of them in your mouth and hold them there. And that's a very sour, intense sensation. Or some cinnamon Altoids, pop them in your mouth and just hold it there. And whatever you were thinking about is going to very quickly go away because the physical sensation is so strong. Or I even tell kids, take a washcloth, wet it, tie it, and put it in the freezer. And when you're having a hard time, try to untie the washcloth. And it's a very intense and almost painful experience that, again, distracts wherever your mind was going. And so if you're able to use your 5 senses, and including being mindful, that can really help to bring you out of that experience.
I can say too, like I'm a combat vet, as Rony had mentioned earlier, and so I've been diagnosed with PTSD, and so I share a lot of the tools and the practices that I use to try to overcome my past stuff, let alone like all of the other stuff, right? But I think finding a network of people like the group here or another group, I mean, there's so many people trying to connect virtually. It's almost overload for me, but you know, I think finding a group of people that you have common interests or common needs with allows you to feel like you're still a part of something, even though we're by ourselves.
Absolutely. One of the things I tell people especially when working on breathing and being mindful, is that learning how to sit with the discomfort is a thing too. And so I talk a lot about, some of these things may not work. Like you may just, okay, I'm done breathing and I'm just gonna sit here and hyperventilate. And I say, you know what, in that moment, it's reminding yourself why you're doing what you're doing, you know, and that's why practicing is so important. So it's not just, oh, I feel anxious, I'm gonna go breathe. I'm like, no. We breathe at 9 o'clock, we breathe at 6 o'clock. Or we have times that we're breathing. That's why, again, exactly. And social connection, right? We don't just reach out to people when we are anxious. We reach out to people on a weekly basis. We touch base with them because there may be a time when you do need to reach out to them, and it needs to be that connection. Just reaching out when you're, you know, upset, or reaching out when you're sad, that's not helping us bring to fruition what we want. We want it to be a calming, we want it to be an uplifting experience. So that's why practice is so important. So I tell people, even if the first time, the second, third time it doesn't work, that's why we keep doing it. Because over time, that association with relaxation and comfort, that's what we want.
Yeah, I love what these ladies
too.
Yeah.
Sorry, I was just going to say, and treatment. So I know there's so much stigma. So sometimes it does get beyond our control.
Absolutely.
And right now, one of the benefits is that most people are doing telepsychiatry and teletherapy. And so there are a lot of opportunities available to seek treatment. I have a therapist. I need a therapist. I frankly feel like everyone needs a therapist.
Yeah.
And even though I know all the skills, I still have to go to my therapist
Absolutely.
and talk to her about, Lord, help me with these children, because I just don't know if I can do another day, and working through that information. And so, again, please don't be afraid to seek help.
Absolutely.
I think I love what these ladies are saying, because, it's really important that we understand that stress is okay. Feeling this way is okay. We talked about that, but we're not saying, no one here is saying we should ignore the fact that we're feeling these things, right? Mm-hmm. We're saying we should acknowledge them, be comfortable with the discomfort, work through them, that sort of thing. But I think there are, even when thinking about breathing, sure, the situation cannot be good right now. It could be awful, but maybe being grateful for that breath that we're now trying to feel, right? Because people are passing away from something that's really terrible. And that's not, I think there's certain ways that we can shift our perspective and still embrace how we're feeling. We shouldn't sweep it under the rug, but have gratitude for those little things that we take for granted all the time, because we do breathe at 9 a.m., 6 p.m. all the time in between.
Yeah. And sometimes breathing, I'm using it as a basic thing, but I know sometimes breathing is a trigger for some people, right? Mm-hmm. So for some people, when they do start to breathe, they're like, oh my gosh, the anxiety is coming. Mm-hmm. I'm like, there it is, right? So being okay with that, but it's also reaching out to people is socially, that can be something that can be anxiety provoking for people. You want me to talk to people I don't know? I'm like, here we go, right? So it's understanding that, yes, the very things that can be helpful to us can also bring on those same anxieties, and be okay with it, and then work towards that. And as you mentioned, absolutely reaching out to a professional. I've gotten so many emails about insurances now. They wouldn't reimburse for telehealth. Now they're like, call anybody. I'm like, okay, grandma does not count. But, if grandma can get on Talkspace and get her, a thing, she counts. So making sure that you are reaching out, because so many times, especially in a time like this, we pull in, we isolate, and it's important that we kind of go outside. So the patients I've been working with anxiety, I'm like, you guys, this is your Super Bowl, right? We've been working on this. Come on. This is when you're supposed to open up. You're supposed to be able to, and so they're like, and I didn't do this on purpose, but recognizing the skills that we've been working on, this is when we use them. Mm-hmm. And they've mentioned oh, that's what that's about. So,
and so how has life changed for all three of you with telehealth? Are you seeing more patients now? More clients?
Oh my gosh. So I gotta say personally, I've been so I have a couples therapist and a personal therapist. I've been wanting a new therapist, and I'm hesitant to go on to telehealth to find a new therapist at this point. But that's just because I've been doing this a really long time, personally, for myself. I will say, for me, from a client perspective, not to mention my life has completely shifted, right? So I'm now work from home. My daughter's home with school. My husband's actually still working because he's mortgage banking. So balancing a lot of different things like everyone else. Sure. But organizations are looking to pivot, right? Because they're going from working in an office building to working remotely, and in, working with, tech companies. It's now they obviously, there's more budget when it comes to mental health and talking about stress in the workplace and making people feel more comfortable. So there are more resources out there, which is really great. But I'm excited that I think one of the posts I read recently on LinkedIn was how companies are treating their employees right now is a great indicator of how they're going to treat their employees ever. Yes. So I 100% firmly agree with that. So I love my interactions every day.
So it's changed somewhat for me. I was already doing telepsychiatry, working in rural parts of the state where there are no psychiatrists. And for a lot of people, the only access they could get was through telepsychiatry or, working with their primary care doctor. So I was doing that before, and there is actually a lot of evidence showing that the efficacy of telepsychiatry is very similar to the work that gets done in person. So now, all of my work obviously has shifted. It's difficult. It's really hard for kids. And I think we really need to acknowledge the loss, especially for our high school students. They've lost their prom, they've lost graduation, and these kids are really grieving. And sometimes I think people are like, oh, whatever, it's just junior prom. That's a big loss for them. Deal. And so, and so a lot of the work now that I've been doing via telepsychiatry is grief work. because, you know, people have, again, we kind of take for granted that we could go to a restaurant, or that we could go play basketball, or that we could work out at the Y. And those were parts of our lives that were really helpful. And now that those have been taken, we have to find other ways to cope, but we also have to acknowledge the grief. And I actually walk people through the stages of grief because it's real. You know, we were in denial for a very long time.
Yeah.
And so we kind of have to work through that. And then those last two stages are acceptance and meaning. And so how can we accept this? And then how can we make meaning of it to still give our lives purpose? And I do that even with 13-year-olds because they still need that motivation.
They're learning. And for me, this is very new. I see patients in a primary care office for 30, 45 minutes, and then I go to the next person. Now, they don't want to come in, right? Because one, they can't come in because we're doing a lot of the testing screening. So they're trying not to have a lot of patients come in. So working with people on new technologies, I feel like I'm an IT manager sometimes. You know, your microphone's over there, and you know, even for me, I had to like figure it out. So I'm just sharing what I learned. So I think that's the other thing. But the accessibility, I have patients now who say, like, I have a couple patients, I don't know if I'm ever going to see them in person again. Now that I know I can do this, they're like, wait a minute, I have to drive an hour to get to there, and and so. But that's been the nice part of it. But I think, as I've said to them, it's about connection. So the reason that I tried to get as quick as I could onto some kind of model where I could reach out to them, because I feel like it was important for us to stay connected. And so I'm trying to model for them how to do this. So I'm like, yes, it's uncomfortable to be on Zoom with me or whatever we're doing, but I think you need to reach out to your grandkids this way as well. And they're like, oh, okay.
Is this the future? Are we now in the future?
We are here.
Yeah,
the future is now.
It was moving in this direction anyway.
It's
just fast forwarded by like 100 times.
Oh,
This is the future.
So we needed to be ready for this. It had to happen way too fast. But we needed this.
It's been coming.
Yeah, right. So some people watching may find that they are unable to fall asleep or having a hard time sleeping at night. Why is this happening? And what can they do to combat this?
Because they can't shut their brains off.
Yeah. So that's another side effect of anxiety and worry. That's one of, like I said, the first things I ask people about is, how's your sleep? I don't ask if they're worried, if they have anxiety. I always ask, how's your sleep? And they'll tell me the exact thing. I can't turn my brain off. I'm going all the time. And one of the things that we find when we become anxious is this inability to sleep, not being able to turn our brains off. So how do we do that? So again, breathe, but figure out how to, ways to relax yourself. So we talk about, just basic sleep hygiene, which can, be important. And then, a sleep specialist might look at true insomnia. So insomnia is the inability to fall asleep or stay asleep, right? Mm-hmm. So what happens, at least for me, a lot of my patients with anxiety, they'll say, I can knock out easy. Like, it's just that I wake up at 1 or 2 in the morning and then I'm up. Mm-hmm. And I'm like, yeah, because you were exhausted all day from your, so whatever. And then you finally fall asleep, but then you wake up when your sleep cycle, and again, that's another lesson, but when your sleep is less likely to be as deep, that's when you wake up and then you're up for the rest of the night. Mm-hmm. So your brain is going, and you're not able to regulate those systems as well when you're worried.
And we're also glued to our phones and our tablets. Mm-hmm. And unfortunately, and I don't always practice what I preach, but the recommendation is shutting off your screen 30 minutes before bed, because blue screen disrupts our sleep. And we are not sure what we're reading. You don't know what you're taking in. And so whatever you've just read on Facebook or on Instagram, that's in your mind and you're thinking about it, and it's hard to slow down. Whereas if you did not have that intrusion 30 minutes before sleep and you were able to focus on something more enjoyable, that certainly would make it easier to fall asleep, because you're not experiencing those stressful issues or those interactions or texting or, whatever. And I always tell people, if you're able to, put your phone on silent at night, because your friends are also not sleeping. And so they're going to text you, they're going to call you, they're going to message you throughout the night, and that disrupts your sleep. And then again, sometimes with depression and with anxiety, even with all the sleep hygiene stuff you try, you still cannot attain a healthy good night's sleep. And, you know, there are a lot of very good, very safe medications that can be used even over the counter. Melatonin, for example, is a medication that people often use. Melatonin is an endogenous chemical in our brain that tells us when to go to sleep. And when you're depressed, your melatonin is down. When you're anxious, often your melatonin is off. And oftentimes people take that. So I can't make formal medical recommendations, but it's always something I tell people to research. Not when you're pregnant or breastfeeding, that you have to talk to your doctor, but there are a lot of natural options that can help us sleep.
Well, Dr. Nicole, are there adverse effects to taking melatonin?
So long-term, so a lot of the studies recommend that melatonin not be taken for more than 1 year. So there's a risk that very long-term use of melatonin, so over a year or 2 years, that it could suppress your endogenous production of melatonin. So then making it harder when you finally do stop to use melatonin. And in pregnancy, actually, melatonin can affect hormones. So that's why it's not recommended that melatonin is used when women are pregnant.
Okay, got it.
The other technique I like to mention to people for falling asleep, and it works with children as well, is what Dr. Ernestine was referring to before that she does with patients in her office, is the body scan. And so I think the technical term is wet noodle, and where you actually go, that's how it was taught to me at a trauma seminar. But so,
I'm going to use it.
But so where you like literally go, like start at your feet and you like tense your muscles and release, and you notice that, like you go with your feet, your calves, your thighs, your butt, your belly, your shoulders, your face, and then you do that a couple times. And I know that, like, you know, for my husband and a couple other clients that I've coached, it's like 2 or 3 times. If you just focus on your body scan, you're able to fall asleep. For me, it works best when I wake up in the middle of the night because I'm thinking about a dozen different things. And when I bring my attention back to my body, that's all I'm thinking about. So I end up by falling back asleep. So it is usually a pretty good recommendation.
See, there was a question about not being able to fall asleep because of being out of the normal routine and not having to go to work. And partly it also may be we're just not as tired. So we're getting up. Normally we're going to work, we're rushing, we're walking, we're using a lot more physical energy that we're probably not using when we're home. So one reason that you may not be sleeping is just because you're not tired. And then so that means, like, so I have a standing desk, and at some point during the day, I like lift my desk up and then I stand for half the day and I sit for half the day, or, you know, in between patients, I'll do push-ups or sit-ups. So because I know I have to like do something physical, I also try to get outside as much as possible, and I still get dressed like I'm going to work. So I still shower and do everything, maybe just from the top up, since, you know, the bottom down, we can be more comfortable, but
I need you to get something.
But I still, again, like I get up and I get dressed as if I'm going to work because I want my body to still be in that routine.
Well, and even the sunlight, right? You know, it's important to have exposure to sunlight. So I've been like, okay, people, I know it's been rainy a few days, but there's still, the sun is out, even though it's raining, because if it's not, we've got other problems. And so making sure that you get at least some exposure to sun and getting that fresh air is just, again, those are the cues that our body relates to. And recognize that I tell people, let's start setting alarms. I have, like I said, I have a patient setting an alarm for water. You know, it might be setting an alarm to get out and go get your sunlight, just to be a cue to remind you, like, these are things I need to do. Right. We have the same thing for sleep. When I'm working with patients around sleep, it's, okay, this is time for me to get ready for bed. I've had it since I was like 3, 9:30, forget it. As a matter of fact, like I can tell you when it's 9:30 all the time because my body has like a set time. That is my schedule to get ready for, I'm not in bed, but my brain is saying it's time because that's just the rhythm that I have. And if we find that, making sure that you're paying attention to that rhythm can be important. It doesn't mean you're going to bed, but you kind of start winding down, getting your body ready.
This sort of goes into that whole thing of what we were saying before, right? Like there's not much we can control, like most of the time. So setting reminders and, you know, forcing ourselves to be in a routine and get ready like we're going to work and do all, these are things we can do to actually improve our well-being right now.
Absolutely. Absolutely.
So I want to kind of shift gears a little bit. There are some questions that we probably won't get to tonight, and I do want to get the audience to ask some questions. So on the actual coverage of COVID-19, you know, there are some jobs that are not flexible, or workers feel like they're not in a safe environment, particularly reporters out in the field. What should they do about this?
Well, I talk to my patients a lot about setting good boundaries and taking care of yourself. And so it's important to make sure that you know what your limits are, and to be able to communicate that effectively to the people around you. So, you know, I know what the CDC has recommendations, but you innately know for yourself, you need to trust that. And so when you do that, you're true to yourself. And it may it may be anxiety provoking in the short term, but in the long term, it tends to put people at ease. So work on what boundaries do you have, setting those, and how do you communicate those to the people that you need to, in terms of your boss, and or just basically the people around you that maybe you're talking to, that you need to let them know where you stand.
And Crystal, you work with a lot of organizations with, you know, basically employers and employees. What would you recommend to a manager that is running an operation? I mean, they were initially, before this pandemic, they were running the operation, and now they're having to deal with running the operation, running with multiple personalities, and dealing with this whole coronavirus thing.
It's like their lives are turned upside down. And because you have to figure, so the people that are working right now are people that are essential, right? So we have supermarket workers, logistics people. We have people locally here in Nashua that are working, that are producing masks and like that sort of thing for medical, the medical area. You know, and I think like, so employers they have a responsibility to their employees to ensure they're healthy all the time, regardless of what the environment is like. And so I think like supermarkets are doing a good job of limiting hours, allowing special shopping hours for certain types of individuals and that sort of thing. Journalists are going to be you know, I'm media too. So like we're essential personnel when it comes to stories and that sort of thing. But I think like, as Dr. Ernestine was saying, like there's a point, and I mean, maybe this is the military in me coming out, that if you're an employee and you're uncomfortable with the situation that you're being put in, you don't like, that's actually where like the line is drawn, right? And so it is your responsibility for yourself and others to ensure that you do speak up. And honestly, like I think there's always a fear, right? There's always a discomfort or a fear with having the tough conversation. Completely get that. But I think it's having the perspective of, okay, if I'm feeling like this, somebody else is feeling like this too.
Right.
Right. And so being able to step up and have that talk, but, you know, I guess I'd like to assume positive intent, right? So like the employer may not even know, like they may not even realize that they're putting their teams in a situation that they're not able to social distance, or there isn't 6 feet apart, or they're touching other things that other people are handling without gloves. Like they may not even be aware of a broader issue. And so if we can man up and, you know, talk to whoever's in the, you know, the higher up, the decision maker, and share what our concerns are in a professional way. They're at this, in a time like this, everybody's dealing with stress. I think as long as we handle things professionally and respectfully, that, you know, we should just not be scared to have that conversation.
And I think we can't be afraid of taking care of ourselves and self-preservation, because often, you know, if you're even as journalists, I'm sure you feel a commitment to your job, and you feel like people are looking to you and they're waiting for you to give them information. And so you often may feel like, well, the way I feel needs to be secondary and pushing forward. And physicians are the same thing. So I'm doing a lot of work right now and supporting physicians on the front line and advocating for them. And one of the biggest issues that comes up is if you are not healthy, you cannot care for other people. If you are not in a mode of self-preservation, there's nothing good that you'll be able to do for other people. Right. So if you're not advocating to wear a mask when you know you're in a situation where you could be exposed, that means that not only are you risking your health, but you're risking the health of people around you. And sometimes it just needs to be a very clear statement to your employer, this is unsafe. Absolutely. And I value my work and I value the people that I work with, but I cannot do my job if I do not feel like I'm safe, and I cannot do my job if I'm not healthy. And at this point with this virus, if it's not safe, it's not worth it.
No. And that's even speaking more for yourself, making sure that you're taking care of yourself too, right? So getting your sleep is keeping other people safe, right? Working only a certain number of hours is keeping people safe. and it's you taking care of you is going to help you do that job. And I say that a lot of times to new moms when they have that. It's like, but I have to do all these things. I'm like, but if you don't take care of you, you can't get these other things done. So I think people need to realize it's not selfish. I hear that a lot. I'm being selfish.
Right. Yeah, self-care is not selfish. It's not selfless.
Yeah. Thank you.
Sorry,
I
think Crystal. The other thing, along the lines of physicians and people that are forced to work right now, I think for me, I don't like to say, there's a lot of like quotes going around, like our grandparents were told to go to war and we're told to stay home or whatever. And I'm like, it's a different world. That doesn't even matter to me. Right. But, when you think about these people, so these folks have to go to work, right. And they know how, they're exposing themselves to the social media that we all have, the news that we all have. So the constant influx of all of these negative stories about the virus we have, and they have to go out and potentially serve us with or without masks, with or without PPE. So they have this additional layer of stress where people get to stay home and protect themselves, but they have to go out and still try to protect themselves. Absolutely. And I think if you are watching and you fall into that category, like these women are saying, self-care is of the utmost importance. What boundaries can you set? What can you put in place? What practices can you have to ensure that you're getting the rest that you need, the food, the nutrition, the water, the time alone, the time in nature, the mindfulness, all of these things that we've talked about are still important to you, even if you're working outside of your home. So I would say just 100% take some time for you and don't feel guilty for it.
No.
And
no is a full sentence. No.
Thank you.
Right. No period.
Period.
So how does one unplug from, we have essential employees, especially folks on this call that are working 8, sometimes 16 to 20-hour days. Yeah. How can they unplug?
Yeah. One of the things I was talking to my colleagues today, I actually asked them, I'm like, what are you guys doing? I'm at a loss. Mm-hmm. And one of the things we talked about was those minute breaks we take in the day. We don't take them anymore. And I was saying that earlier, but making sure you take your breaks. So I always tell my patients, make sure you take your lunch. And here I am, going through, 6 meals, haven't taken a break. So taking that, getting up, as you mentioned, even just getting up, going to another room, but having a set place that this is my break, having those transitions, and having set times. I think this is interesting, right? So I'm like, I don't know if I should say this out loud, but set times for when I check the media. So there's only, no, I'm not watching 24 hours a day. I know I should, but I don't, but I have set times so that my brain can, I talk about compartmentalizing a lot, doing what I need to do in the moment is part of my job. So it's making sure that I'm doing that as well. And putting me in one of those compartments is one of the things I try to make sure to do.
And I feel like our audience is probably let me just watch the media all the time. Right. I feel if you're in journalism, you're probably reading things a lot, listening to things a lot. And it's part of your art. It's part of what you do. It's how you produce and how you find, and I mean, I have to sit here. I'm the same. I can't look at the news because then all of a sudden it's 30 minutes later and I'm like, what did I do? I don't even know what I just did. And so, right. We've all been there, social media. I can't, I deleted Facebook off my phone. I don't check Instagram. I turned off all notifications during the day. I check it at my leisure. I select one news venue to watch, and then that's what I watch, so I don't get 60,000 different opinions. And so I think we all need to self-impose whatever boundaries are right for us. But Dr. Ernestine, you're absolutely right. I forcefully work for 45 minutes, take 15 minutes off. I literally intentionally do that. When I'm a co-parent, I'm divorced, so when my daughter is here, we have lunch together and we do a bar class at lunch. So we get our exercise and we get lunch. She's active and I force her and she hates it.
That's good.
But I mean, it's these little highlights throughout the day that I, look forward to, and I have to schedule in, and I just try to protect them. No excuses, as painful as that is sometimes.
And also just being intentional about what feeds your soul and kind of knowing what is edifying for you and knowing what is not. So, similarly, I even have a note on my phone or an alarm on my phone that tells me to turn off social media because you can so easily get consumed.
Easy.
And realistically, how much new information are we getting in those 3 hours that we're on social media? Not a ton. And so if you were to cut your social media time down to 1 hour from 4 hours, you're not going to miss that much. And if you did miss something, you'll very quickly find out. But I also know what brings me joy. And this may sound ridiculous, but I love Marvel and I love Avengers. So I got Disney Plus through Verizon for free for a year. And I watch Avengers movies, and I watch, movies that I know that are lighthearted and that are fun and where I can escape, because I listen to a lot of people's hurt and their pain, and it's very easy to absorb that. And as journalists, you're doing the same thing. It's very easy to internalize what people are experiencing and what you're seeing, and then you take that home, and that starts to weigh on you. And so if you're not very intentional about taking that deep breath and moving that to the side and then doing something that is calming and relaxing, whether it's watching a movie, whether it's watching TV, whether it's spending time with your kids, figuring out what works for you and what's calming, and then scheduling that as a part of your day if it's exercise. So I recently now, because of this, there are a ton of exercise classes that are free.
I know.
Finally.
So I have this class I do 3 days a week. It's like a Soka Zumba type class, and it's awesome.
Cool.
And I love it. And it's like, it's totally free, and it's a wonderful experience. And so I schedule that. I tell my kids, leave me alone. I tell my husband, don't talk to me. This is my time, and I need this time, because I can't do the work that I do if I don't also fill myself. And so I give, and as journalists, you're constantly giving. You have to spend time filling yourself.
Absolutely.
There was a question in the chat, which is so important that we've kind of mentioned it in this past hour. What about dealing with loneliness?
I saw that.
A lot of our folks on this call are producers that normally work in a newsroom full of people, and now they're alone. They may not have a family, or even if they do have a family unit, that family unit is an essential employee and they're gone all day.
Right.
So they're out alone all day in their apartment, and they're struggling with that whole feeling of disconnected from people, and their job. I mean, now they have to do their job. I mean, we have some producers that are boofing their show from home. Any advice on how you can handle that?
Well, it's interesting, we had our recent faculty member at our meeting, and like people I hadn't seen in years showed up. I'm like, what's going on, right? And it was that need for connection. We were like, we wanted to like be together. And so we talked about some of the things that people are doing. So like virtual happy hours, right? I have some colleagues, they have people they set up to eat dinner with. Just virtually. And it's a time they feel they're with someone else, and they can feel like, and it may be on Zoom, but it's, it could be a conference call, but making certain that you make those more intentional times to get people together. I think it's important. Absolutely.
I sometimes push back a little bit on loneliness, not because it's like not appropriate. I mean, I'm a super, like, I love energy. I'm usually in an office full of people. Like, I completely can relate to that. But, now, I think that our relationship with ourselves is really important. And that's one of the gifts I believe that we're being given right now, is understanding what that relationship should look like. And it's not an easy thing. Like being happy is hard. Being happy is work, like all of that. Right. But I think I think it's almost like ask yourself to go a little bit deeper with that. Like, why do I feel lonely? Like, why am I not comfortable being by myself? I think there might be more there. But for me, this like virtual, I like these virtual talks. I think they're amazing. For me, it gets to be at some point throughout the day when you have so many meetings back to back to back, it could be a lot of digital, right? But I think it's just the intention or the thought or the, and that makes me feel good that somebody wants to have a virtual drink with me or have a virtual conversation. And I think those are little ways that are helpful to make people feel more connected, or, going for a walk outside. There's never been more people walking around my neighborhood than there have been the last month. And I've said hi to people that I have no idea lived here. So, I think like there's a lot of ways we can find connection. It's just, we have to accept, right, that it's not going to be a newsroom full of people.
Yeah.
And I also think, there's people are becoming creative with social distancing. So the other day I was driving past a parking lot, and there were a couple cars in the parking lot. Everyone was in their car, but they were like talking to each other. So they, were keeping their social distance and staying in their car, but still communicating. Or like, my kids, our neighbors will stay across the street, and my kids are going to be on one side of the street, and they're both riding their scooters kind of in parallel up and down the street. They can't cross or get connected, but they're screaming and they're laughing and they're connecting. like there's on the handout that I gave you, there's also a link for Netflix where you can coordinate a Netflix where you can watch it with a friend, or, you know, put somebody on speaker. I just introduced my kids to The Wiz. And so one of my friends was doing, so we were watching The Wiz at the same time, and we had the phone.
Such a good movie.
Speakers, it's a great movie.
Great movie.
And so, like, you know, the kids are laughing and they're screaming and they're talking like, was that Michael Jackson? Oh my gosh, that's so, and so like that. And, you know, even after the movie was done, my 5-year-old was like, wow, mommy, that was really fun. And so, like, we, you know, we're going to have to be creative about that. But sometimes also we miss that physical touch. And so I do often recommend to people, like, sometimes you may even have to massage yourself, squeeze yourself, kind of give yourself that reassurance, because it is hard if you miss that. And so, like, literally like giving yourself a hug, or, you know, squeezing your hands together, or squeezing your legs kind of gives your body that sense of comfort and touch.
I didn't mention this. I mentioned when we were talking about sleep, a weighted blanket. I don't know if anybody else.
My daughter has one. My daughter is high spectrum autism and loves the thing. It relieves her anxiety like crazy.
And so I know that's outside of this, but when you said touch and hugging yourself, that's what I call the weighted blanket. I'm like, it's like a little hug that you get. But that was for sleep. Sorry.
We have a question on the chat, and I'm kind of moving between different questions.
No, are you going to talk about the Q&A one? Because that's something that I'm really concerned about as well, and I would love to hear these ladies talk about it.
And so, you know, what happens when you're trapped in an emotionally abusive relationship?
Right.
You have nowhere to go and no one to run to. What do you do? What are your options?
And that, so if we look at the numbers in terms of police calls, police have been getting an increased number of domestic violence calls and an increased number of child abuse calls. And so that, obviously, that was one of my biggest concerns when realizing that people have to be stuck in an environment where they may not feel safe. And for a lot of people, school and work were their safe havens. They actually got to leave their environment. And so that has, or like being able to commune with other people, that was a safe place. And now not having that is very difficult. Obviously, if there's any way that there's another family member that you could stay with or get to, that's, you know, the easiest answer, but that's often not realistic. So I always tell people, if you can be as busy as possible and try to, you know, even if you're in a 1-bedroom apartment, if you're busy, if you're taking walks, even if you're not working and you look like you're working, and you try to keep yourself distracted and keep some distance between you and that partner, that at least gives you that space where you can kind of separate. And then, you know, ultimately, if it's not safe, and I recognize it's really hard to, but you have to call the police.
Absolutely.
And there are a lot of domestic violence supports throughout Massachusetts. And I can also, Rony, I can send you that information as well for domestic violence hotlines and domestic violence supports. Domestic violence shelters are still open. And so there are still places, if it's an emergency, there are still places where you can go.
There are some really great organizations locally here in New Hampshire too that I know accept out of state folks too. So I always recommend for this. That's like really, I hadn't thought about like pretending like you're working even if you're not. Like that's some really good stuff there. But also, you know, the police obviously are, in my opinion, the best first responders. But 211, the United Way, they offer some really great resources as far as nonprofits go. Marguerite's Place, Front Door Agency, Bridges in Nashua, they're all domestic violence related and willing to help. The other thing is that even though there are businesses closing down and non-essentials are closed down, I know here in New Hampshire specifically, hotels and like places where you can stay will stay open for domestic violence cases. So even though it might feel like we're under lockdown and we're stuck where we are, we're not. The same options exist today and probably are more responded to. Yeah. So I would definitely recommend reaching out to, I mean, any of us would be happy to point you in the right direction. So.
I know a lot of hotels are offering free rooms for frontline providers or healthcare providers, but given the circumstances, I'm sure if you were to reach out that they would be willing to also offer support, because they have a block of rooms now that they're holding for free for people. And that is a great option as well.
This is a very good question. I'm glad that was put out to us. And so this pandemic is disproportionately affected your Black communities, African American communities, Latino communities. How do we cope with that, as journalists and who are not only part of those communities, but are also covering them?
Mm-hmm. Mm-hmm. So I think that one of the biggest things is to just educate our family and friends, because as journalists, you know where your sources are coming from, and you can recognize the truth. And there are so many mistruths and untruths out there that often I think it's allowing people to not practice social distancing and still, I'm going to do whatever I want to do. This is a conspiracy, or this isn't that serious. Black people aren't really getting it. And so, really making an effort to educate our family. So one of my friends is an emergency medicine doctor in New York. So she's on the front lines and is kind of experiencing the devastation. And she just recently had a Zoom with all of her family. And she's like, listen, nobody talk but me. And I'm just, this is your time to listen, and you need to be educated because we're dying.
Yes.
And,
yes.
and a part of the issue of stepping back from social media is that we know seeing racism, seeing these numbers, seeing these stories is actually very triggering. So
Absolutely.
When they've done studies and looked at how people respond to watching a video of police brutality, they respond in the same way as if they were there or had experienced it themselves. So they get the same physical reaction. So as much as possible, taking a step back and distancing yourself, because it is traumatic to re-experience the same negative news and the same very terrifying information over and over and over again.
Yeah.
Right.
I think also understanding some of the issues with the history of disparities within the African American community, as well as Latino community, is recognizing that this has been a longstanding issue, is not new. And that, when people are, I'm so surprised that X, Y, and Z, I'm like, I'm sorry. So when you convey that, it's recognizing that this is another issue that has affected them disproportionately, but it's not new. And so it speaks to the continued need for resources and understanding the issues in these communities. One of the things that came up, the idea of wearing a mask in the African-American community, just out wearing a mask, I'm like, that's not something that a person, especially I think about African-American men. Why don't you go throw on a mask, and why don't you put a hoodie on too? Like, are you?
Yeah, exactly. Yeah.
So thinking about how you convey that information to people, it's like you might want to talk about understanding. I think about, and I know this is not the word, like cultural competence, or just understanding the community that you're speaking to. That some of those issues might be triggers for people, and saying, why don't you just go to the hospital? Have you tried to just go to a hospital without insurance? Like, it's tricky. It's tricky.
Right.
Are you concerned about the mental well-being of Black folks and Latino folks in these communities as this pandemic continues? I mean, just this week, one of your colleagues, Dr. Joseph Bendecourt, the head of equity and inclusion at Mass General Hospital, told WBUR Radio that 35 to 40% of COVID-19 patients are Latino, up 9% from before the crisis. And down in Louisiana, the Department of Health on Monday became one of the largest state entities to begin reporting a racial breakdown of their cases. It showed Black folks account of 70% of the coronavirus deaths in that state, despite making up 32% of the population. Could we potentially continue to see numbers like this?
I mean, unfortunately, yes. There's so many systemic reasons for it. Like there's food deserts. So we often in impoverished communities, we don't have access to healthy foods. There's hospital deserts. I was just reading an article in South Carolina. There are entire counties that have no access to a hospital. And so if someone gets sick, they have to drive, assuming they have a car, but they have to drive an extended period of time just to get to a hospital. And that's time wasted. There's a ton of research that shows oftentimes Black people aren't believed when we go into the hospital. And there's a tremendous amount of implicit bias.
Absolutely.
And so we have to advocate for ourselves even harder than other populations because of, hundreds of years of racism that's still embedded in the medical system. And so there's a theory called the weathering theory. And that theory essentially states because of years and years of systemic racism that it wears down the body of Black individuals. And so when they look at like 40-year-old men compared to 40-year-old white men, 40-year-old Black men physiologically were 10 years older than their counterparts. And the theory is because like this, the poverty, the racism, the experience, the social inequities, that wears on us. And so it changes the physiology of our bodies, and it increases the risk for this opportunistic infection. And unfortunately, if we're not really able to literally stay at home as much as possible, we're going to continue to see this. And that's, it's heartbreaking. And I'm hoping now that people are aware that more services will start to be available to our community.
But you think of the people that are essential workers, right? You have our physicians, and we have our nurses, and we have our medical assistants, we have our grocery workers. And you look around and you see who those people are, and recognizing that they have more exposure as well. So it's not, yes, the systemic issues within the hospital setting, but it's also their exposure to these situations. And think of the homeless and their inability to, social distance. So there's different social determinants that make it more likely that people from minority populations are going to be more exposed. And I do believe it's the exposure as well as the lack of opportunities for health care testing. They're not testing everyone. They're only testing certain types of people.
And even where the testing sites are, very few testing sites are in communities of primarily with people of color. They're just not there.
And you need a car, right? That's one of the issues that someone was posing to me. Okay, they say I can go get a test, but I have to have a car to get there. You get to get in line, and it's like, I have a car. And, they're not going to get an Uber that's going to test it in line with them. Those are some issues that we just paying attention to that.
Yeah.
So we're going to switch over to our audience watching this webinar online. If you folks have some questions, please ask away or raise your hand below, and we'll try to get to you and answer some questions. Otherwise, we'll kind of wrap this up and let our panelists get back to their regularly scheduled programming.
There is I see there's a question at the top about how to set healthy boundaries so that when you're working, you're working, and when you're not working. So it's hard, especially if you have other people that live with you and you're trying to get stuff done, so you're interrupted frequently. But again, I try to treat it the same way I would treat when I'm not here. Unfortunately, I tend to take work home a lot anyway, but at some point we have to turn off the light and close the door. And again, if you have a routine, that is a trigger to let you know, the workday has ended. So dinner is when my workday ends. And so that's, for me, that's how I know that the day has ended, is that when it's time for dinner, what I haven't finished today, unless it's urgent, will have to wait until tomorrow, because it's very easy for your work and home life to bleed together. But again, and this is, it's going to take practice, because this is an entirely new situation for most of us. And again, kind of setting those boundaries, and also letting your family, when I'm working, please don't come in. If I have to put a lock on the door, whatever, so that it's clear to everyone. But it is hard. And again, if you get dressed like you're going to work, and then when you're done, you get undressed like you're coming home, that also kind of signals the body to let you know that you're transitioning.
I was thinking like a Mr. Rogers thing, right? Like you have a sweater that I have because I work in a medical setting, I have an outfit that I wear to work. And then when I come home, I take it off, it's got to go in the washer or whatever. But I was like, this is kind of like Mr. Rogers. Like I've got my little Converses and my sweater I put on. And then, well, not today because I was doing this, but, but having that transition, that's great. The other thing I talk to patients about is making sure, this is before all this, but I work with a lot of people who have lists, and I'm like, okay, we have a list. I'm going to shut it down to 3 things on your list. And if it's on your list tomorrow, then it's too big a task, right? So those just basic things like that, because I think I'm going to get everything done on this list and then I'll be done. I'm like, no. Hit the top 3 and let's move on. And now I would say the top 1 and move on. We're not doing the 20-minute list.
Right. So we have a question in the Q&A. For those who have lost multiple streams of income to this pandemic, what advice do you have for them to cope, considering they don't really know when this will end?
Yeah.
That's such a difficult question, because because no one has a definitive answer. And that is, challenging. I am definitely encouraging people to utilize the resources that are in your community, like the food banks. And food banks are recognizing that many people are struggling and they cannot afford basic groceries. And I think there's often some shame in going to pick up these things. But every single day at a lot of the Boston YMCAs, they have breakfast and lunch available for children. Every single day, Monday through Friday, at a lot of the schools throughout the state, they have free lunch available. And you can get it from one or both places. And sometimes through the Boston public school system, they'll have deodorant and soap and whatever kind of toiletries that you may need. There's no shame in getting those things, because most people are going through this struggle. And if we're not there yet, the chances are many of us will get there, because we have no idea how long this is going to go on. So one thing is, please, as much as you can, setting aside your pride and utilizing the resources that are available. No one should be going hungry right now, because there's plenty of places where you can get free food. Again, if you go to the Boston Public School website, they list all of their locations where usually I think it's like 8:30 to 11:30. You can pick up meals for your kids, and the same with the YMCA. You can also find food banks. There are also a number of restaurants that are giving out free food. So Representative Liz Miranda in Dorchester, she's working with a lot of restaurants who they're making bags of food for families to get that. But I think, ultimately it's relying on your support network, relying Absolutely. On your family and friends, and, as much as possible, trying to just take it one day at a time. Worrying about next year is not going to change what happens. What you can try to do is get through today. And then once you get through today, then it's tomorrow, and you're dealing with tomorrow in that moment.
Yeah, I think like what you said is completely spot on. And, this is like one of those moments where like the ego just needs to like go away, right? Because we're all just trying to survive every single day, and it looks different for everybody, but there are resources and they're there so people can take advantage of them. Otherwise they wouldn't be. So
absolutely.
Well, Dr. Ernestine, Jennings, Dr. Nicole, and Crystal. I almost called you a doctor. You know what? You should be a doctor. Just go get that doctor.
I know.
I want to thank you all. I want to thank all three of you for joining us and having this conversation, this important conversation about, journalists and dealing with this pandemic. It's obviously an important topic to have. And I also want to take a moment to thank our folks on this call and our organization, BABJ, for allowing us to do this tonight. You could learn more about our folks. Let me share that screen so folks can contact them afterwards.
Can I say one more thing while you're wrapping up, Rony?
Absolutely.
I think the one thing that's always and I just actually did I did a webinar on this, is that like, while things are really tough, it's so hard to understand that there's something good that's going to come of it. And I think like there is something good coming from this. Nobody knows what it is yet, but it will happen. Like, we'll know. All of a sudden we'll be like, oh, that's why this happened. So even though it might be pretty bad right now, my outlook is that it will get better, and there is a reason. So hopefully people get some sort of comfort out of thinking that way.
Absolutely. Thank you. So thank you to all three of you for coming in today. I really appreciate it. And for the folks at home, this is how you can connect with Dr. Nicole, Crystal, and Dr. Ernestine. Their contact info, that's how you can follow them on social media or send them an email. And before we end today, I want to say a special thanks to our members from both the Boston and the Southern New England chapters of NABJ. Barbara Moore Silva, Juanine Nunes, Paris Alston, Paris Carter, Shonda Foster, and our VP, Zanindra and Wameka, for helping to put this program together. You can learn more about our mission by visiting our website, bostonblackjournalists.wordpress.com. And a special thanks to you all watching at home or at work or wherever you may be tonight. We hope that it was useful. For the Boston Association of Black Journalists, I'm Rony Camille. Please stay healthy and safe. And until next time, take good care of yourself and your families. Goodbye.
Thank you.
Thank you.
Thank you.